Kia ora, it's Isis here from Women's Health Action, and today I am joined by Whitney and Katie, and we're going to have a bit of a chat about breastfeeding, and in particular, what to expect when accessing services during COVID-19 pandemic. So, Whitney and Katie, can you tell me a bit about yourselves to start off with?
Kia ora, I'm Whitney. I am a Leche League leader in Tauranga at the moment. I've been a leader for only about 6 months, but I started off my breastfeeding helping career as a peer supporter down in Christchurch, and I've been doing that for about 4 years. So yeah, been helping breastfeeding mums for about that.
Awesome. And how many children do you have?
Oh, yeah. I've got a son who has just turned 4, and a daughter who is not far off turning 2.
Oh, nice. That's awesome. And Katie, do you want to tell us a bit about you and yourself?
Kia ora. So I'm Katie. I'm one of the leaders based in Hamilton. I've been a leader for about 1.5 years, and I have 3 children who are 6, 3, and 10 months old. And yeah, I joined the Leche League with my second when he was a baby, and still breastfeeding him now. So yeah, it's been
awesome. Cool. So as you might know, we recently conducted a survey of, we've had about 350 responses from people all over Aotearoa, and understandably we found out that many people are feeling really anxious about breastfeeding during this time. And to give you a bit of a background, over 36% of the people who responded are currently breastfeeding, and over 40% of the respondents are planning to breastfeed when their babies are born. And over 50% of the respondents reported not having enough information about breastfeeding and breastfeeding support during COVID-19. And most respondents reported that COVID-19 hadn't changed their intention to breastfeed or their intention to continue breastfeeding, although a small percentage had indicated that they were less likely to stop due to the, immunity reasons, and a few did report that they might stop breastfeeding if they were tested positive for COVID-19, which is a trend that we're seeing internationally. So it was quite good to see that that wasn't something that was really prominent in the responses to our survey in Aotearoa. And like, I know that the Ministry of Health, for instance, have plenty of information about the importance of breastfeeding during COVID-19 and the sort of precautions that we might take. And we've covered that off on a separate video, but I thought maybe if you could tell me a little bit about La Leche League specifically and what you do during business as usual and how this might have changed during this pandemic.
Yeah, sure. So the Leche League was set up as a mother-to-mother peer support service. So our philosophy is mothers helping other mothers. To become a leader, you need to have some breastfeeding experience. I think at the moment it's over 9 months of breastfeeding experience. So anyone you speak to as a Leche League leader will have been through some challenges themselves. So normally we work via regions. So each region has its own local group. And at least once a month, that group meets and has what's called a series meeting where we discuss issues about breastfeeding, where people are welcome to come and ask any questions that they have about their own breastfeeding challenges or experiences, or just to catch up with other mums. We also offer one-to-one support. So in normal times, this can be sometimes home visits. It can be catching up in like a playground or another place just to have a chat. And we also do coffee groups at leaders' houses or mums' houses just to have some contact with other mums. So obviously since the lockdown started, this has had to change the way we operate, and we had made the decision quite early on that we would cancel nationally all face-to-face interactions. Unfortunately, just you know, to protect both ourselves as leaders and the mothers that we're helping. And so these days we're still having all our group meetings. We're still having all our group meetings, but they're now being held over Zoom. And so women are able to join in with their usual groups, like our Tauranga group is still meeting, but it's at our normal time, at our normal day, but over Zoom, like so many other organisations are doing.
Cool. And so where would people go to find that information if they were looking to connect with a leader in their region or join one of these Zoom meetings?
So the best place to get up-to-date information is probably our national Facebook page. That's the one that gets updated most often. So you can find that at Breastfeeding Support, La Leche League New Zealand.
Great, we'll make sure we show that in this clip. Are you still doing phone consultations, I guess, if that's the best word? Are you still having phone chats with people at this time?
Yes, so we are continuing with all the different ways we support mum, except for face-to-face.
Yeah.
So phone, email, Facebook Messenger, any other method that mums usually use to contact us. We're still trying to carry on with that as much as possible.
Cool. And for people who were wanting to have a phone chat, I understand that for most leaders, there's a phone number on the website that people can use to get in touch with the leader in their region?
Yes,
cool.
That's correct.
Cool. So I thought, I guess not surprisingly, people had some specific questions and concerns about establishing and continuing breastfeeding during this time, and I thought you guys would probably be well placed to answer those questions. So I'll ask you a few of those if that's okay. So people were quite concerned about maintaining their milk supply during what could be quite a stressful time for breastfeeding people, and I wondered if you had any tips for maintaining milk supply during this time.
So I think that's certainly a real concern for mums out there. At the best of times, lots of us worry about our supply, and so having this stress on top of it is definitely amplifying that. I think one of the most important points is to look after yourself. And so mums need to make sure that they're, resting as much as they can, looking after themselves, remembering to eat well, and doing all those normal things to look after your own body. But then in terms of the supply itself, I think lots of us are getting asked for feeds more often, and so that can lead to worries about, well, are they asking because my supply is dropping or my production's dropping? And that's often not the case. We're a bit of an easy target when we're at home and we're sitting around more, and our little ones are wanting connection. And so often it can be as simple as contacting one of our leaders or someone who knows about breastfeeding and just running through your worries and saying, should I be concerned about this? Are there signs here that my supply is actually low? Is this something I should be worried about? And we can help you with that and then give you tips about if it is a problem, keeping production going.
Cool. And so that sort of leads on quite nicely, I guess, for the next question, which was around tips for increasing milk supply. And I guess if people, like you said, if people do have concerns about that, they can get in contact with you, because I know that like you just said, I know that sometimes it can feel like if your child's feeding behaviour changes, is that due to a supply issue? And often it's not. So do you have information, I guess, that you can access or that sort of talks to what you would look for to establish whether or not there is a supply issue and what you might do to help get that back up during this time?
So the Leche League has quite a helpful website, and it's not just the New Zealand one. So there's the Leche League International and the Leche League Great Britain, and they all have quite handy articles that talk about milk production, which is one of the most common concerns that mums have. There was something else that just came to mind when Whitney was talking about the basics of maintaining your supply, which is stress can affect a mum's letdown. So one of the quite common concerns that we hear is, my feeding's been going fine, and suddenly my baby seems really dissatisfied, and when I pump, not much is coming out. And often mums will think, oh, my milk supply's just disappeared overnight. And we know that usually doesn't happen unless, you get given some medication or something that stops the milk. And even then, often milk does take time to go away. So if you find that the flow of milk suddenly stops, it's usually not like a supply issue, but rather a letdown issue. So, and with a stressful situation. So usually to help with that, we would recommend or encourage mums to try and do some relaxation exercise. Distraction can really help. It's a matter of like finding different ways that will help us to relax and encourage the milk to flow. And, if you're really unsure, like Whitney said, all the leaders are around and we're thinking about the mums and we're worrying about them. So if you just want to reach out, then one of us can talk you through your concerns.
That's really awesome. That's actually really a good thing to keep in mind. The other issue that came up a lot was what to do if people are experiencing nipple pain, blocked ducts, cystitis, thrush during this time, and who they might be able to get in contact with and how to discuss those issues.
Sorry, my 4-year-old just tripped over the cord.
I love it, keeping it real, we're all in the same boat, aren't we?
This is definitely real at our house. So I think one of the things to remember is that your GP is still open too. So especially in the case of mastitis, if you're not feeling well, then calling your GP should be your first port of call. But definitely for any of those issues, blocked ducts, worries about mastitis, any of those issues, any concerns, the phone numbers for your local leaders are all on our national page, and you can always PM our Facebook page and one of our leaders will get back to you as well. So yeah, all of those concerns, and most of them, apart from mastitis, if you're unwell, most of them are things that we can easily talk you through, like some gentle massage for blocked ducts and frequent feeding and hopping in the shower to really open up the ducts, using cool cloths if there's lots of pain and inflammation. All of those things are stuff that we can talk you through without needing to see you in person. So we're still here.
Awesome, thank you, that's really helpful. The other thing that people were wondering about was about teething and breastfeeding, and sort of in more general feeding a child who is a bit older, who is getting teeth, and and I imagine it's much the same as the other things. Get in touch, check out the website, the Facebook page, things like that. Do you have any things specifically that you want to chat around that sort of thing? And I guess any other common questions or concerns that you're hearing from people during this time?
I just add that if you're still under the care of your midwife, it's quite good to be in touch with her as well. And I know they are, they're part of our essential workforce, so they would still be doing visits. And I guess in terms of teething and other resources, again, it's something that causes mum stress. If you're in pain, it's hard for the milk to flow. So I just really encourage mums to try and get help like early on, rather than, when things are unbearable and it's quite hard. It'll be a lot harder to turn things around.
On the
Thank you.
teething, I'd just like to reassure any mums who have babies that haven't quite reached that stage yet, that a lot of babies go through teething and you don't notice a difference with breastfeeding. A baby who's latched well will be covering up their teeth, or at least their bottom teeth, with their tongues, and so the presence of teeth or not doesn't necessarily have to mean pain for mums. Some mums do notice that while babies have that kind of strange feeling in their mouth and they can be a bit more uncomfortable, then that does mean that they're using their mouths in a slightly different way, or they're kind of experimenting with the different pressures and how things feel. And so for those mums, they might have babies who are making breastfeeding a little bit more uncomfortable, but it doesn't necessarily happen for everyone. Teething doesn't equal breastfeeding problems.
Yeah,
that's so true, Whitney. And often if you go back to the basics of getting your baby in nice and close, getting a deep latch, getting them into a good position, it really helps the babies to figure out how to use the changing shape of their mouth. And not letting lots of clothes get in the way. So being stuck at home is actually probably quite good for this type of thing, because you could, walk around topless and do skin to skin, and that's all very helpful for breastfeeding.
Yeah. And actually, I guess on that topic of skin to skin, it's not something that we'd sort of talked about in advance, but I guess what I am hearing that some of the positive sides of this whole thing is that people are almost being forced to spend more skin to skin and close time, especially just after their babies are born. And I know in my own experience, things like skin to skin, even when my children were a bit older, were really good at a good thing to sort of do, I guess, during illness, but also just in times of stress to just help calm people down and stuff. Is that something that you would recommend doing?
Absolutely.
Yeah.
We know that skin to skin doesn't only give babies special happy hormones, but it also gives mothers, and breastfeeding as well gives boosts of oxytocin for mothers as well as babies. And so that kind of thing is just so important. There's nothing better and more relaxing than a warm bath with your baby and sniffing your baby's head and just really enjoying the feel of their skin and that sensation of them up against your chest. So absolutely, as much skin to skin as you can.
And that's something dads can do as well. So, if mom's being skin to skin with the baby all day and she kind of needs a break, getting dad to go into the shower or do some skin to skin with the baby is really helpful, especially in the evenings when babies can be a little bit fussy. So I think it was like 15 or 20 years later, the families where dads have done skin to skin with the babies, their marriage is better, the baby has more academic achievements, and apparently they earn more. So
Wow.
yeah, it's really fascinating.
So I think we might have just missed that slightly. Was that a study that was done at some?
Yeah, on dads who have done skin to skin with the babies in the early days.
Cool.
Yeah.
That's awesome. And I guess maybe on that topic, again, slightly deviating from some of the things that we sort of thought we might talk about, is there anything else that you might sort of recommend for dads or partners that they could be doing during this time to help their partners with their breastfeeding journeys? Other than the old feeding the baby.
Yeah, I think the main thing is to look after mum. We know that breastfeeding works really well when mum and baby are in sync. So the more, the mum can be enabled to feed the baby responsively, the easier it is for her. Like often dads will think, if I give the baby a bottle, it'll give mum a break. But actually, if dad takes care of all the housework, all the other kids, feed mum and let her relax and just focus on the baby, it's going to be less work for mum and the most helpful, I think, for everyone, even though it's not, not such a sexy thing to do.
It sounds like really good advice there. Cool. Well, was there anything else that you wanted to add? Anything else you've been thinking about?
I guess we haven't talked about the specific COVID risk with breastfeeding a lot. But just to confirm, the guidelines out there at the moment from the WHO and from our own Ministry of Health are recommending continued breastfeeding and initiation of breastfeeding for all mothers, regardless of their COVID status. We know that it's spread through droplets, so it hasn't been found in breast milk. And if you do become positive, it's likely that your baby's been exposed before you developed symptoms or knew that you were positive. And so the best thing that you can do is keep breastfeeding.
That's great, absolutely. And I know that the like you said, the Ministry of Health.
So COVID.
Oh, sorry. You go, Katie.
And I just wanted to add that COVID is one of many like different diseases that we're kind of exposed on a day-to-day basis. So we know that breastfeeding is protective against many health conditions for the baby and for mum. So it is like a scary situation because we don't really know everything about this new COVID-19, but we do know a lot about many of the other diseases that have been around for a long time, and the risks of not breastfeeding. So like, while you're going to be hearing lots of scary things coming out in the media and people are trying to do research as fast as they can, it's quite good to just stick to the basics and you know, keep feeding.
Yeah, that's really good advice. Thank you. And again, we can point to the information on the Leche League website as well as on the Ministry of Health about the specifics in regards to COVID-19 and feeding. Yeah. Cool. Well, was there anything else?
I just really wanted to tell the mums that, you know, we're still here. The Leche League leaders are all around. We're all over New Zealand and we're thinking about you and we want you to, you know, have a good time with your baby, and we're here to support you if you need us. And also the lactation consultants as well. So a group of lactation consultants in New Zealand have started a group called Lactation Lockdown, which is I think they have a Facebook page. So if you find that you need a little bit more support than sort of the mother-to-mother support that we can provide, there's another good place where you can get some lactation consultant support.
That's awesome. We're actually going to be talking to, I believe, the person who, the LC who set that page up in a few days. So it will be a really great complimentary video to this one. How about you, Whitney? Did you have any sort of, any signing off points that you wanted to make?
I just want to echo what Katie said, that we are, you know, absolutely here at the end of the phone, on the other side of the Facebook page, and we're really all just waiting for you to get in contact with us, and we can provide as much or as little support as you want. Please just get in touch. No question is too small.
That's awesome. Thank you both so much for spending some time chatting with me today, and I'm sure that people will get a lot out of this video. So thank you very much.